Good afternoon and welcome to the Parenting Tips for Challenging Times, sponsored by Help Me Grow, Comunidades Latinos Unidas in Servicio, CLUES, and Minnesota Act Early, and Ramsey County's Early Childhood Initiative, also known as RECE. I'm Nancy Lee, the coordinator of RECE, and I'm pleased to be here with you today. I want to let you know that we have muted everyone, but we welcome your questions. If you'll please use the question and answer box, not the chat, and we'll be happy to try to intersperse those into our session. We have just 30 minutes, so I want to quickly introduce our panelists, and they'll talk a little bit more with them so that we can get as much information packed into this session as possible. First, we have Brandon Jones. He's a psychotherapist, a professor, and integrated services manager at North Point Health and Wellness Center. Brandon holds a BA in sociology from the University of Minnesota and a master's in community psychology from Metropolitan State University and a master's in psychotherapy from Adler Graduate School. Brandon is also a 2013 Bush Foundation Leadership Fellow. Next, we have Deanna Wilson. She's a parent who has a 2-year-old named Aiden. She currently works at Hennepin County, and Deanna enjoys helping and being around others and going on little adventures. And one day she would love to travel to another country, particularly Africa, to ride an elephant. And finally, we have Nakita, Natala, an MD. She is a child and adolescent psychiatrist at the University of Minnesota. Dr. Natala was born and raised in St. Paul, Minnesota. And she returned back home to Minnesota last year after completing her training out of state to join the faculty at the University of Minnesota. So Dr. Natala has a special clinical interest in cross-cultural mental health and working with children and families who are healing from trauma. So I'd like to move us right into our discussion today. Dr. Natala, would you offer some introductory remarks about the topic of trauma as we navigate this challenging world that seems every day to be filled with negative incidents, and what the development effects might be of that?
Sure, thank you very much, Nancy. Very happy to be here with everyone today. So I'll just briefly give a couple remarks about trauma. I currently work with children and adolescents. I work with a lot of children, adolescents, and families who have, especially right now, been very traumatized by everything that's been happening in our communities with the transitions and the restrictions that have occurred because of the coronavirus pandemic and how that has been disproportionately affecting our families of color and our children of color. I think the most important thing to think about right now with coronavirus is that it's affecting all of us, but in different degrees. And that's what I've noticed the most, with certainly, like I mentioned before, our families of color and our children of color being affected, I would say definitely disproportionately. And so being aware of that is really important as we talk about the coronavirus pandemic, and especially with everything that's gone on in the community. I think especially as a professional of color, I have had mixed feelings about everything that's happened since the murder of George Floyd, with people now talking about race more than ever, but knowing that it's existed for a really long time, that these issues are not new, but also having some hope that things will change. And so we all have gone through a number of emotional transitions and stressors in the last couple of months, and it's been taxing. And it's certainly affected some people more than others. For our younger children, I think it's important as parents, I would say, for us to just be really in tune with how our children are experiencing this really challenging time, and being cognizant as well of how we're experiencing them at these times as adults. You know, trauma is kind of it's a broad term to describe a very, there's variations in how people experience trauma. And some people experience trauma to the point where they end up with a psychiatric disorder or a mental health disorder. Um, the specific disorder that we talk about a lot is post-traumatic stress disorder, or PTSD.
Mhm.
Some people have more mild effects of trauma, but there really is a spectrum of how people will react and how children will react. And I think the main things to watch for in your children right now, and sort of warning signs that your child may be experiencing more than usual trauma at this time, are changes in their behavior, changes in their sleep, particularly nightmares, or them talking repeatedly about being afraid, particularly right now with all of the talk about police brutality and police violence, conversations about being afraid of the police, being afraid of being treated differently based on the color of their skin, or conversations about friends of theirs maybe being treated differently by police. But having a child that's repeatedly talking about things and seems to always have worries on their minds, those are things to be paying attention to. Increases in aggression, or what we would say like maybe not following directions as well, like more tantrums, more outbursts, really any changes in behavior that you're noticing, we'd encourage you to reach out and try and find some support for your child and for you as well, because these issues are affecting the entire family. The other thing to note is that within a family, some children will be affected differently, right? So within a sibling pair, within a number of people in a family, you might have one child who may just have experienced mild stress, or may even in some ways be doing better. I mean, we've seen some kids that actually like distance learning, for instance, but different siblings and different kids are being affected differently. And that's really a product of their background and if they already had some sort of a predisposition to mental health issues. And so it's just important to also recognize that everybody is experiencing this differently, even within families. And I think I'll stop there. But certainly, you know, we want to make sure people are reaching out for help, because this is a very high risk period where people aren't able to access as many services as they would have in non-COVID times. And that can certainly have long lasting effects on the child's growth and development going forward.
Thank you for those introductory comments. Brandon, chime in here on what you find significant about developmental effects, particularly maybe also on very young Black boys, of the incidents that we're experiencing in society right now. Can you see that there could be some concerns for those young children, preschool in particular?
Well, for preschool age children, one thing we have to keep in mind is that they're understanding the world at their level, and their brains are just developing. And by the time they get about, 3, 4 years old, their brains are entering a phase where their synapse connections is starting to enter the highest level of development. So these young children are soaking up so much information about the environment and learning about things. And when they're exposed to things like George Floyd or just general community violence or domestic violence, they're associating themselves with that violence, whether they're seeing themselves as a victim, sometimes they're seeing themselves as a perpetrator, and you'll start to see young boys start to act these things out. Generally as young boys develop, they're very physical, young people. They're climbing on things, they're throwing things, they're yelling, they're eating a lot, they're exploring the world. But then when you add this extra element of violence or this extra element of violent imagery, they start to associate those things as being okay, or they may be in those positions themselves. So when you talk about, young children that age, that's what we're looking at. Their brains they're not, fully developed, but they're at a high level of development, and they're soaking up imagery. They might start to ask questions. Another thing that happens during this time period is young children start to ask questions, even to the point as parents, we get to the place where we don't want to answer all those questions, or we tell them things like, you stay out of grown folks' business, and they're like 3, 4, 5 years old. But we need to be able to have age-appropriate responses for the questions that these young people are asking, because one thing that happens when we don't answer questions that young people have is they'll try to go find it out on their own. Now, if we're talking about preschool age, they're not going to go find it out on their own per se, but they'll find it out when they get 6, 7, and 8 years old. Once they get access to the internet and Google or the community, they'll ask questions there. Or what ends up happening is we start to kind of kill the curiosity of young people, and then they don't know how to ask appropriate questions or when to speak up or when to assert themselves, because they're adjusting socially to the environments that we set up. So it's important for parents to have adequate communication on what stress is, what trauma is, even what toxic stress is, to these young people because they are soaking up all that information from the environments that they're in.
Wow, that was really telling, just to remember about how the little ones are soaking up everything that's happening around them, even if they're not able to talk about it or express it in the way that we as adults might. Deanna, I want to bring you in on the conversation from a parental view, and in talking with other parents, what new question would you pose to Brandon or Dr. Natala? Give us some of your perspective. Unmute yourself, please.
Okay. So I have a question. Yeah, with everything like kind of like closed and can't have access to a lot of things. Some people are, in the house now with their children a lot of times. So I have a few people that I know, family, friends. So my question is hitting your child, is that teaching, as they get older, is that teaching them that it's okay to hit others? That's my question.
Got it. You want to go first, Dr. Natalia?
I'll probably let you take this since you're more of a therapist.
Gotcha.
Response.
Gotcha. So it's one of the things that we always go back and forth as human service professionals as well as mental health professionals on what do we do with spanking. As professionals, we are mandated reporters, and technically, if you tell us that you're spanking your child, we're supposed to report that. But one thing that's important is you have to have some cultural intelligence and understand how different cultures utilize spanking to discipline your child, because it ain't just Black folks who do it. It's all people who end up spanking their children. I have dealt with children from all different backgrounds, and spanking has been one of the resources or tools that's been utilized for parenting. What I say about spanking is this. What spanking does is it teaches your child to utilize violence to solve problems, but it's a temporary solution. Spankings don't give a long-term solution to stopping the problem. It doesn't really teach much of anything. It just stops things in the moment. One thing that I would encourage people to do if you are spanking your children is you need to have what we call compassionate accountability. Now, the accountability is the spanking. You need to be very mindful of the difference between a spanking and abuse. Now, a spanking might be a couple taps, 1, 2, 3, or 1, and then it's over. Abuse is punching a child, yelling at the child, swearing at the child, choking a child. Like that is a completely different element of discipline. I'm not really pro spanking because I think that it's using violence to teach children how to solve problems and not other tools. But I do know that parents do them. So what I say is, if you're going to choose to spank your child, try some other methods first. Explain to your child, you need to stop, you need to sit down, you need to put that back. I want you to stop doing that. Please watch your mouth, things like that. Have a dialogue with your child so they learn to use words to solve problems and not just physical actions. If verbally doesn't work, then you go to a physical action, which is put them in timeout or put them in a space. And maybe you don't call it timeout. Maybe you change the name. This is a calm space. I want you to sit here. I want you to take a minute. If that doesn't work, then you intervene as a parent, and now you and the child are doing discipline together. Okay, I want you to calm your body. Look at me, look at my eyes. You might have to sit down. You might have to get to their level and say, look at my eyes, and we're going to count to 10. And I want you to calm your body and breathe. Now you're doing something that's different than just popping the child and hoping that they stop the behavior. Spanking should always be the last result. I always say at least try 2 to 3 things before you get to that level. But I understand, parents are in the house, parents are stressed out. Parents have become the teachers, the caregivers, the disciplinarians, the everything, the playmates of their children. And it's a lot because you still have work to do. You still have your own interests. And it's just this combination because all of our lives have been disrupted. And spanking is something that is a huge concern, as well as intimate partner violence, because violence is something that we've utilized as Americans as an easy solution to solve our problems. But I don't think that is the go-to solution for our children.
Yeah, I would just add that I agree with that 100%. Thank you, Brandon, for putting that in such a straightforward way. I think the only other thing I think about when I think about spanking too is oftentimes, like you alluded to, Brandon, parents are usually frustrated and upset when they're giving a spanking. And so typically we like parents to be disciplining their children when they're in a calmer state, more rational state. And oftentimes when you're in a place where you're spanking your child, you're upset with your child. and you're in a little bit more of a probably kind of bordering on that irrational state. So that's another reason why typically I like to also encourage parents to find other ways to manage or to discipline their children without physical management.
And also spanking is more about you, right? Because you feel good after you spank the child and the child has stopped doing the behavior that you did not want the child to do. It's not really about the child. It's about your own kind of level of control as well.
That's an excellent point, that when we as adults, so to speak, lash out with spanking or in other violent ways, it's really about us and our frustration and not being able to express or convey our emotions in a way that's more positive. And so I wonder, what about families who feel that their children may be showing some kind of developmental delay, and they're having challenging behaviors with them that seem to be really excessive and getting in the way of the child functioning well in the family? What would you suggest for what parents do in that instance?
Mm-hmm. Well, first, assessments should probably be handled. So, when you're taking your child in for their regular checkups or they're getting their shots, mentioning to those medical professionals some of the behavioral things you're seeing so that they can make recommendations for assessments to be done. Because a lot of times children have developmental issues or concerns, but the parents aren't aware of it and they just see it as bad behavior or my child's not listening. And then we get into situations like the spankings and the other levels of discipline that it might not be, the child, misbehaving. It might just be a developmental issue that the child has. So getting an assessment is extremely important. After the assessment is done, what I encourage is utilize some of the suggestions. Some of the main things that are important for developmental things in young children are diet, making sure that your children have adequate nutrients as they're taking in things, changing environments. I think about children who have ADHD and how they have attention issues, but if you shift their environments around, sometimes that helps. Changing where their bed is in the room, changing the posters on the wall, mixing the toys in and out, all those types of things help that child navigate their space a little bit differently. So environmental changes. And then the third thing that I would add is screen time. One of the things that happens with a lot of young people who have developmental issues is they get plugged in front of a cell phone, they get plugged in front of a tablet because the parents don't know what else to do, but they know that YouTube Kids and ABC Mouse and all these other little apps that are cool will gain the attention of the young person. But we can't just let the tablets end up, babysitting and cultivating our children. We also have to engage and play with them as well.
Yeah, I would agree with that. The only thing I just wanted to add to that is just that social emotional development is one of the core domains of child development. When a lot of people think about development, they think about, is my child walking on time? Is my child talking on time? But really the social emotional development of a child is equally as important as those other more commonly known domains. And so if you're concerned about the way your child is managing their emotions and engaging socially with other children or with the family, that's another really important thing to bring up to your medical provider, like Brandon said, or to bring up at school, or really the Help Me Grow program too is a great place to go for more help. Just really trying to find somebody in the community to help. I, as a psychiatrist, end up seeing kids when they're when those issues are severely impacting functioning, and then we might talk about other interventions, with medications always being the last resort for these children, always wanting to do environmental things first. But I think, like Brandon said, reaching out early is important because we all know that with early intervention, the outcomes are better.
And it is through the Help Me Grow program that there can, a referral is online. It can be a self-referral by a parent or another care provider, so that the family can be referred to the local school district for some free developmental screening and evaluation. So thank you for reminding us of that, Dr. Natala. And it's all no cost, early intervention services as well. Deanna, what question do you comes to your mind from some of the things you've been hearing talked about, or that is of interest to you?
So far, Well, I can agree with Brandon when he was saying that the spanking doesn't do anything, obviously at the moment, because you're mad. But I had a question about mental health. So if a parent has been diagnosed, with mental illness, can a child have the same thing the parent has, or will they even like be diagnosed with something like that?
Good question. For some diagnoses, so let me start off and say this. If a parent has a mental illness and they've been diagnosed, that does not automatically mean their child will have the same or any other diagnosis. There's no correlation that says that. What is stated is for some mental illnesses, for example, schizophrenia, more personality disorders than anything, that it increases the probability that their children or other offsprings and generations ongoing can have those similar illnesses, but it doesn't guarantee that they will. So just because one person has a mental illness doesn't guarantee that a child of theirs will have it as well. But what is important is for parents who do have diagnosis of mental illness is make sure they get treatment, because a lot of times when they don't have treatment, whether that's medication or various types of therapies, them dealing with their symptoms can lead to other either social issues or behavioral issues, or even sometimes other mental health issues of their children, because they're in an environment that can be unstable, that can be unpredictable, and sometimes can be, just unassuring of what's going to happen, because, the parent is isolating because they're struggling with, anxiety, or, mom's gone again, or they're talking irrationally, or whatever's happening. Children can start to develop things based on the environments that they're in.
Yeah, and I would just add, I echo all of that, I agree with all that, Brandon. I think the other thing that's really important is if, as a parent, like you were saying, Brandon, if you do have mental health difficulties, making sure that you're getting treatment for yourself is really important, particularly if your child also is struggling with mental health, because it can be very difficult, just if you don't have a mental health disorder as a parent, to parent a child who has mental health challenges. And so it's very important for the whole family to be well. And I spend a lot of time encouraging parents to get their own help too, which can be hard. It can be really hard, but it's also very important because you can't give from an empty cup.
That's a great analogy. Thank you for that. There's a question from the audience. Do kids sometimes feel they are responsible for bad things that happen?
Absolutely, they do. Even if it has nothing to do with them. We see this in research around divorce, where a lot of children from divorce of all ages, even up to about 23, 24 years old, children of divorce feel like they are the cause of their parents getting divorced. So, you can take that same assertion when it comes to young children who start to associate, what's going on? Why are these bad things happening? Is it my fault? Is it because I'm here? Because that's what children do. Again, their brains are developing. And as much as we don't like to admit it, children are very self-centered. This is why they fight over things that are just silly. It's like, no, that's my book, or you're sitting in my spot, or, it's my turn to choose what we're going to watch, because they're about themselves, because they're developing in the world. They don't understand all the social cues and dynamics. It's all about them. So when bad things happen, they do the same thing. Well, is it my fault that I'm being yelled at? Is it my fault that I didn't get a treat and these other kids did, or that we live in this community or in this house and we don't have this and these other kids do? Children absolutely take that upon themselves because they're very self-focused as they develop in the world.
And I would just add to that I think that this really gets into a discussion about even internalized racism, right? So the more that children, I think, start to blame themselves even for just being discriminated against, right? Or start to feel like they're worth less based on the way that society, treats Black people or discriminates against Black people or other children of color. And so children really do take on a lot, whether it's trauma or just microaggressions or other things that occur in their communities. And so it's really important as parents to, especially if you're raising a child of color, also to spend that time to really build your child up too, and help them understand what is and isn't their fault. And most things aren't their fault, right? They're just in an environment that they don't have much control over.
Exactly. We I mean, this conversation could go on for quite a while, but we only have a few minutes left. And what I want to do is just mention a couple of things that have come in through the Q&A so that people know. Someone asked about books or movies to recommend to just help discuss trauma. And I do have a list which I will send out through your emails that you have all listed here. And there are several more questions that I think are going to take much more time than we have. But what I would like to promise the audience is that I will send those questions to our panelists and ask them just to write a short few sentences to share, so that when we send back to you information about the books or movies on trauma, they might also be able to answer some of those short questions that we have here. And then I am going to ask Marty Smith to open her mic for just a moment to talk about Help Me Grow, and is it open at this time during COVID? So Marty, can you?
Hi. I did type a response to that question. At this time, you're free to make a referral through Help Me Grow, and that referral does go to the school district. If the child is under age 3, you will get a call probably within a week from someone, an early childhood staff person at the school, who will talk with you about your concerns about the child and decide from there if there should be a developmental screening or an evaluation for eligibility for infant and toddler intervention, which are services provided free through the schools. And if your child is between ages 3 and 5, you may not get a call back in response to a referral until later in August, when school staff are back in session, because 3 to 5 services follow the school calendar. They're not year-round like the birth to 3 services.
Well,
I hope that
thank
answers your question.
Thank you, Marty. I appreciate that. And thank you to everyone for a wonderful roundtable discussions. Brandon, Deanna, Dr. Natala, very helpful and has me thinking a lot about some things. Again, I want to thank all of the sponsors, which include Help Me Grow, Clues, Minnesota Act Early, as well as our Ramsey County Early Childhood Initiative. Thank you, everyone, and have a wonderful day.
Take care, everybody.